Hi, my name is Tracy Thompson. I'm an OB hospitalist for OB Hospitalist Group in Virginia, and I'm here to share my LifeSave story with you today. I want to tell you a story that happened a few months ago. This was a 36-year-old young lady who was pregnant for the second time. She previously had an uncomplicated pregnancy and vaginal delivery, who had found out after trying to get pregnant, had found out a few days prior that she was pregnant, and she was very excited about that. But then the day before she came to our emergency room, she started having some abdominal pain, and it got so bad that she eventually was brought in via EMS, via ambulance, because she had a syncopal episode at home and couldn't move well on her own. Upon her arrival, she was found to be in shock, essentially. Her blood pressure was very low, her pulse was very high, she was very sweaty. The emergency room physician quickly identified that she probably had a ruptured ectopic pregnancy based on her known positive HCG or positive pregnancy test at home, and got some basic labs, and including a hormone test for her pregnancy level, and then called me. I came down immediately. This was an unassigned patient, so she had no OBGYN who worked at our facility. So I was the correct person for them to call at the time. I went down immediately to see her, and she was found to have fluid in her abdomen based on a bedside ultrasound. And based on her report of a positive pregnancy test, I went ahead and called the OR supervisor to open up the OR for me. They had to call some people in from home because they didn't have an OR readily available, but they got on that right away. And in the meantime, her labs resulted, and she thought she was about 4 weeks pregnant, but based on her hormone level, she was probably a little bit more than that. And IV fluid resuscitation did a good job of bringing down her pulse, although she remained with a fairly low blood pressure. So I went ahead and called for some emergency release blood based on the amount of fluid I saw in her abdomen, which was presumed to be blood on ultrasound. And as soon as the operating room was ready, we moved to the operating room. On our arrival into the operating room, we had our first unit of emergency release blood going for her. And we quickly got her put to sleep by anesthesia and positioned so that I could start my surgery. And she appeared stable enough that I felt like I could do a minimally invasive procedure instead of a big incision on her abdomen. So that's what I proceeded to do. Once I got inside her abdomen, I found 2.5 liters of blood. And once we cleared all of that out of there so we could see, I found her right fallopian tube had ruptured. It was almost completely separated from the uterus, about 1.5 centimeters from where it inserts into the uterus, and it was actively bleeding. So I removed that tube because it was deemed unsalvageable. And the surgery was fairly quick and uncomplicated. She proceeded to end up needing 2 more units of packed red blood cells, a blood transfusion, over the next 36 hours, but ultimately did well and went home.